In addition to having the pleasure of working as the Dean of the College of Health Sciences since 2009, I have also had the enormous pleasure of working as the Executive Director for the Delaware Health Science Alliance, which is one of the sponsors of today's events. And for me, today is a really important day. As you heard from all of our congressional delegation this morning, the topics that we are taking on are very difficult and challenging ones. And we feel very strongly that the environment of an academic institution is the place where we can really take on those enormous challenges, have the open conversations, and then really design the solutions, as we always do in Delaware. It's not just about the conversation, it's about designing the solutions and then making them happen. And so the Delaware Health Science Alliance was actually conceived, I believe, in the spring of 2009 before I came. And the first leader for the Alliance is the person who really brought us together here today. And that is Dan Rich, who was the provost when I was first interviewed. Can you please all acknowledge and give a heartfelt thank you to Dan? So I came in 2009, and even being a Delaware native, I'd been gone for 20 years, and so Dan took me under his wings, and he took me around the state, and he introduced me and reintroduced me to many people. And again, sometimes people talk about the Delaware way, but the Delaware way, as you've heard today, it's all about getting it done. And that was also when you had knowledge-based partnerships, and again, this is another knowledge-based partnership reintroduced, and today it's very exciting that it is about health and education. Because I think you all know that if you have your health and if you have education, you have the world of possibilities in front of you. So we've worked over the last 8-9 years in the Delaware Health Science Alliance, along with the University of Delaware and our partners in the Alliance, Thomas Jefferson, AI DuPont Nemours Children's Hospital, and of course, Christiana Care Health Systems. And we've all worked to raise the level of biomedical research in the state of Delaware, to work very hard in educating the next generation of healthcare workforce. And then we've worked as well to design new models of clinical care and comprehensive care and integrative care that includes prevention and wellness to bring about better health outcomes for the whole entire state. It has also been my distinct honor and pleasure along that journey to have two major partners. One of them, Bettina Riveros, I would ask her to please stand. She then was the health advisor for Governor Jack Markell. So we formed a close partnership, and our other partner in crime, who you will hear from later today, but I ask her to stand as well, Rita Landgraf, the former Cabinet Secretary for Health and Social Services. And we had many other partners, but the three of us were sort of partners in crime, and we have all gone to different, well, I haven't, I hope, although my boss is here, so he'll tell me if I'm still in my current position. But Bettina is now the Senior VP for Government Relations and Community Engagement, and then I am proud to say that we brought Rita Landgraf to the College of Health Sciences, where she serves as a professor of practice and the director of our healthcare partnerships and healthy community partnerships. So during the time period that we have worked, we also quickly realized that having a memorandum of understanding really didn't get the work done, and that we needed something more, and we needed more force and power behind it. And so we created an LLC and a 501c3. So the DHSA grew out of a memorandum of understanding to a formal 501c3, and we also realized that we needed someone to, in fact, lead that full-time with energy, determination, and an ability to get things done. And so we have chosen a new lead for that, and I would ask Dr. Omar Khan, who is our new president and CEO for the first time of the DHSA, to please stand and be recognized. So Omar is, as many of you I'm sure know, has been leading the Global Health Initiative for the DHSA for a long time, and he also is family and community medicine practice at Christiana Care and wears many, many hats, too many of them which I probably couldn't even identify right now. But we're very, very thrilled to have Dr. Khan be leading the DHSA from this time point forward. During the time period over the last years or so, one of the things that DHSA, I think, has enabled us to do is to really bring about and elevate biomedical research. And so we've seen the grant funding dramatically increase. There's a huge commitment to make those grants actually translate into better health outcomes for the individuals in the state of Delaware. Two grants that really typify that well are the Clinical Translational Research Award, which Stuart Binder-McLeod is the lead of that from physical therapy at UD, and he works with partners across the state on that particular grant. Another grant which actually was awarded to the state, and again, Bettina and Rita really in the lead for that, the CMMI grant, so the Center for Medicare and Medicaid Innovation, and the SIM grant. So it's really $30 million to the state, and I see a lot of the partners and the DCHI leadership, Julaine and others, and Matt, who have really been strong leaders in really moving forward healthcare innovation. As you heard many, many times today, we can really do this as a state, and we can really make this happen. So now, actually, it gives me a great pleasure to introduce my boss, President Dennis Asanas from the University of Delaware. And I have to say that, that one of his first steps onto the UD campus when he was named president was actually to land on the STAR campus, the Science, Technology, and Advanced Research campus. And I think that's rather symbolic, and symbolic of his vision, which is extremely exciting. And that is, it's all about being a university that is engaged with your community, and that brings about transformation that is based on the knowledge that is generated within universities. So it's about partnerships of people in practice with partnerships in knowledge, and bringing all of that to translate to better outcomes in education and in healthcare, which we're focused on today. And without further ado, I introduce President Dennis Asanas.